Dark circles under eyes are due to excessive pigmentation and shadowing due to tear trough and downward infraorbital fat migration. We have decided to treat this patient with hyaluronic acid filler into the tear trough area, as that could be one of the reasons of dark circles under eyes. After proper cleansing with chlorhexidine, we draw the borders of the tear trough area, as you can see here, and then I draw a line from the mid-pupil downward. This is the infraorbital foramen, and this is the point of entry for my cannula. I use a 3.8 ml cannula, gauge 25, although I still prefer the usage of 22 gauge cannula. And always remember that the tear trough should be treated by specialists specifically trained and experienced in this technique. Then I will start to introduce my cannula. Usually I go under the orbicularis muscle, very gently and very slowly to treat the infraorbital central region and the medial region and the lateral region. I use my finger to support the tear trough and to protect the eye. We inject very slowly into TT1 amount of 0.1 to 0.3 ml using the micro alicate technique, using very small droplet of fillers 0.01 to 0.05 per point. Then we change, as you saw, the direction of the cannula to TT2 or the lateral infraorbital region. Remember that we inject under the orbicularis muscle, otherwise you will have pumps. Then we move to the medial infraorbital region, TT3, and inject 0.1 to 0.3. Usually it depends on the severity of the tear trough. As we did before, the structures affected are the lip-cheek junction, the palpebral malar sulcus, and the nasojugal sulcus. Then we clean and we exert a very light massage for even distribution of the filler under the eye. Usually, after I finish, I like to exert some pressure with my hand. This will give the patient calm, relaxed, and excited feeling to see the results. Here you can appreciate the difference between the right and the left eye. For the left eye, we will mark TT1, TT2, and TT3. And here I will use the needle, so you can see the needle versus the cannula. This is the angular artery, and this is the infraorbital foramen. This is a dangerous area, so you have to be very cautious in injecting. I use my hand To support my syringe, I go very slowly, I aspirate, I wait from 1 to 9, and then I inject very slowly with very little pressure on the plunger, and then I move out to do some pressure. To spread the material, and then I move to TT2. The tear trough is the natural depression that extends infralaterally from the medial canthus to meet with the palpebromalar groove that extends around the lateral half of the infraorbit. Injection slowly, and then I will move my needle gentle massaging, and then I will go to the third point, which is the TT3, or the medial infraorbital region. This is the dangerous area, so you go very slowly, you touch the bone under the muscle, you aspirate again from 1 to 9, and then you inject very slowly. Please, in this area, inject very slowly. Point 1 to point 3. Then we're finished. A clean, light massage for TT1, and then again I exert with my hand some pressure.